Take, for example, the 10% tax on medical device companies. Until this bill, companies would donate their devices to needy people under a humanitarian use law. Now, with the 10% tax, they're not going to be able to do that. This bill will worsen the shortage of doctors. A recent survey showed that up to 30% of primary care doctors will quit practicing medicine if this bill is enacted. And that's at a time when the Bureau of Labor Statistics says that we're going to need 22% more doctors in 10 years. So what's going to happen is primary care doctors are going to be relegated to just supervising nurse practitioners and physician's assistants. In Canada, a place that the liberal progressives think has a really great medical system, they're considering letting PAs do hip replacement surgery and knee replacement surgery. I don't think that's the kind of care we want in America. Massachusetts developed an interesting solution to their problem, their doctor shortage problem. They're called group doctor visits, and this is the truth. A bunch of people with the same problem all go to the doctor at the same time, sit in the same room, tell their story to the doctor listens to you, evaluates everything, gives everybody some advice. I can't imagine what it's like if you've got a prostate problem. To address this shortage, changes are already happening in medical education. On the day that Obama signed the health legislation into law, a Texas medical school announced that it was shaving 1 year off its curriculum. And this is at a time when medical knowledge is exploding. Here's what we need in healthcare reform. First of all, we can start with the sickest of the sick people. 10% of people account for 70% of healthcare spending. By improving care for these patients, we can reduce overall costs up to 30%. So we need to expand medical research on these serious illnesses so that we can improve our treatments and drop our costs right there. Secondly, people should have individual control over how your healthcare dollars are spent. There was a RAND study a few years ago showed that when people had direct control over how they spent their healthcare dollars, they spent less money and they had the same health scores as people who had free care. But this new bill eliminated health savings accounts, which is what allows for that. So we need to at least repeal that provision. Insurance policies should be portable. We need to open up competition among insurance companies. And we need tort reform so that lawyers like John Edwards can become multimillionaires by suing hard-working, well-meaning country doctors. In short, we need to restore the old doctor-patient relationship, let market forces drive costs, increase competition in the insurance industry, limit malpractice cases to the truly egregious, get better at taking care of the sickest among us, and promote community and family values so that we can better help each other in times of need. Now, to be fair, not all doctors oppose the health care bill. I recently overheard two doctors lamenting that the Democrats hadn't used enough propaganda to get more public support. Well, yes, they did. They distracted the public by drawing attention to the weaknesses in our health insurance industry to obscure the real goal of socializing medicine. This bill will make the private practice of medicine unfeasible. Private clinics will disappear, maybe even become illegal, like they are in Britain, and hospitals will go bankrupt and be taken over by the government. Insurance companies will go out of business because if employers' choice under this new bill is to pay a few $1,000s for an insurance premium or pay a fine to the IRS for $2,000 per employee, I think I know what most employers are going to do. In a very short time, this will leave the federal government as the single payer. Ultimately, after the government takes over all hospitals, clinics, and physicians' offices, we will finally have the superior health care that they have in Cuba. If you think that this is an extremist prediction, recall that in 2003, Barack Obama said, "I happen to be a proponent of a single-payer universal health care plan." In August 2008, he said, "If I were designing a system from scratch, I would probably set up a single-payer system." And then 3 weeks ago today, on March 25th in Iowa City, President Obama said the bill doesn't do everything that everybody wants, but it moves us in the direction of universal health care coverage in this country. They want want us to become dependent on government for health care. And as other nations have demonstrated, once health care is socialized, the die is cast for other segments of our society to become nationalized and controlled by the state. Look at the student loan industry. In one quick move, the liberal progressives, by attaching amendment to the health care bill, wiped out an entire private industry, the 35,000 people in the student loan business, and converted it to complete control under the government and the Department of Education. No more competition for student loans, all under government control now, without a minute of debate. Remember Thomas Jefferson's words. Any government big enough to give you everything you want is strong enough to take everything you have.
That's right!
And by everything you have, I think he meant more than just your money. I think he meant your life and your liberty and your pursuit of happiness.